About half of what I do pertains to skin cancer, prevention, diagnosis, and treatment. Skin cancer affects more individuals in this country every year than all other cancers combined. 1 in 5 adults in this country will develop skin cancer by the age of 70. And we know that there's very predictable risk factors that lead to the formation of skin cancer. So much emphasis, in what I talk to the press about and what I talk to my patients about is early detection and prevention. The most important aspects are sun protection first and foremost. We know that more than 90% of skin cancers are attributable to UV radiation. So this is a modifiable risk factor. And that starts first and foremost with sunscreen. Now, sunscreen is imperfect, and this is what people need to understand. It's not enough to put 50 on or even 100 on and then go spend the entire day out in the sun. Sunscreen is better than nothing, but it's not nearly enough. So it should be one component of good sun protection. You also need to use sun protective clothing. There's so many good brands now that make UPF clothing, which implies a steady protection. So UPF is sort of the protective factor of the clothing against the sun. And a UPF of 50 means that you're blocking 98% of the harmful sun rays. And then the nice thing about clothing is, unlike sunscreen, it doesn't wear off after 2 hours. Hats, sunglasses, and seeking the shade are also really important. Protection is all of those measures. And then I counsel patients, and I believe fervently in the importance of regular skin checks. So you should go in once a year for a skin check by a physician, but as important as those annual skin checks is self-surveillance. And this is the part people don't want to hear. They don't want to have the burden on themselves. But what I would like them to do is spend just a few minutes once a month when they get out of the shower, even just a very quick cursory glance at their, not clothed skin might yield recognition of a new spot. And about 80% of melanomas are brand new spots. Only about 20 to 30% arise in pre-existing moles. The vast majority will be a new spot that appears and then continues to grow. You should never sit on that. You should always bring it to medical attention and get it checked out, because that can save your life.